Welcome to the European Parliamentary Research Service podcasts.
In this podcast, we'll talk about ensuring healthy lives and well-being for all, one of the most pressing of the 17 UN Sustainable Development Goals, and yet one that will most surely be missed by 2030. So stay with us, and we'll look at what the EU is doing at home and worldwide to achieve this crucial objective.
The Sustainable Development Goals, or SDGs, were adopted in 2015 as part of the United Nations 2030 Agenda for Sustainable Development. They cover health and well-being, poverty, hunger, education, gender equality, environment and climate, strong institutions, peace and justice, among other issues. Many very closely linked.
Number 3 in particular aims to ensure healthy lives and promote well-being for all at all ages. Key objectives include reducing mother and child mortality, ending epidemics of communicable diseases such as AIDS, malaria or tuberculosis, reducing non-communicable diseases such as heart diseases or diabetes, and making sure that everyone has access to quality healthcare, including mental health.
Now, because health is inextricably linked to issues such as poverty, equality, water and sanitation or education, achieving this particular goal requires broad and comprehensive action worldwide. So how well on track are we?
Well, truth is, quite off track globally. So while there's been progress in combating infectious diseases such as AIDS or reducing child deaths, the impact of the COVID-19 pandemic, coupled with Russia's war on Ukraine and other ongoing crises, has disrupted global progress. And some regions, especially in sub-Saharan Africa, are seriously lagging behind in many targets.
According to the World Health Organization, in 2023, only 15% of health-related SDGs were on track, and less than a third of them were likely to achieve their 2030 targets. So what is the EU doing about it, both at home and abroad? Let's look at domestic efforts first.
With strong health systems in place, the EU comes quite well off in relation to SDG 3, but it still has work to do. Eastern and southern regions still face higher health challenges than those in Western and Northern Europe, and cardiovascular diseases and cancer remain a serious concern. Moreover, COVID-19 put European health systems under heavy stress and seriously affected citizens' mental health, lifestyle, and socio-economic conditions.
Now, to combat the spread of communicable diseases, essential legislation was passed in 2022 under the European Health Union umbrella. For example, strengthening epidemiological surveillance on serious cross-border health threats, setting up a health task force to be able to act quickly during a major outbreak, and a health emergency preparedness and response authority to procure medical countermeasures before and during a serious health crisis.
It has also developed programs to reduce non-communicable diseases, which represent 80% of disease cases in Europe and cause most premature deaths. An example is Europe's Beating Cancer Plan, which focuses on prevention, early detection, diagnosis and treatment, and patients' quality of life.
But there are many other initiatives, focusing on mental and occupational health, for example, or addressing food quality, air pollution, which continues to be the #1 environmental cause of premature deaths, exposure to hazardous chemicals, and other environmental, commercial, and lifestyle-related risk factors.
The EU has also taken action on road safety with the objective of 0 deaths and serious injuries by 2050, and strengthened tobacco control to ensure that by 2040, less than 5% of Europeans smoke. An ambitious goal, considering that now 26% of them still do.
To achieve more resilient, accessible and inclusive health systems, the European Commission proposed in 2023 a new pharmaceutical legislation package. The idea is to make medicines more available, accessible and affordable, while keeping industry competitive. Let's hear the words of European Commissioner in charge of health, Stella Kyriakides.
Our political vision is to build an ecosystem for medicines that is both industry-friendly and puts patients at the center. One in which, as I say, the 3 A's are ensured: availability, affordability, and access, and that these need to go hand in hand with industrial competitiveness.
The Commission has also stepped up the fight against antimicrobial resistance, an important health challenge not only in Europe, but also worldwide. So, let's turn our attention to EU action in support of health-related sustainable development goals globally, especially SDG 3. Stay with us.
Through multilateral fora like the WHO, G20 and G7, as well as regional and bilateral initiatives, the EU pioneers global health, helping to achieve the SDG 3 objectives globally. Its 2022 Global Health Strategy guides action on 3 interconnected priorities: better health throughout life, universal healthcare coverage, and preventing and combating health threats.
These are aligned with those of the WHO, with which the EU works together closely to deliver universal health coverage, improve health outcomes in emergencies, and strengthen global health security, among others.
The EU also supports its African and other partners with health-oriented initiatives under the EU's Global Gateway and through its Team Europe approach, where possible. The idea here being to join forces between the EU, its member states, and their financial and development institutions, as well as the private sector, to ensure the EU's external action becomes more than the sum of its parts. Here's Gabriele Leclerc from the European Parliamentary Research Service.
Ensuring security of pharmaceutical supply chains and the development of local manufacturing is the priority of health-related initiatives under the Global Gateway. For instance, in Africa, a Team Europe initiative on manufacturing and access to vaccines, medicines, and health technologies supports the supply side, demand side, and the enabling environment. The initiative has committed more than 1.3 billion euros towards more than 80 projects at the continental, regional, and national levels.
The EU is also a member of both the G7 and G20 groups, whose actions on health-related matters have far-reaching consequences worldwide.
Now, the European Parliament has always supported stronger EU action on health, both internally and outside the EU. It has repeatedly called for a comprehensive and integrated approach to it, drawing attention to the interconnections between physical and mental health, and addressing all risk factors that impact it, be they of environmental, social, or economic nature.
A strong believer in the leading role the EU can play in global health, the Parliament has also called for stronger cooperation between the EU and the WHO, because one thing is certain: health threats do not respect country borders. So, it's only in working together that we will be able to attain a high level of health and well-being for all, as SDG 3 advocates.
Want to know more? Check out the full policy brief by Gabriele Leclerc on the EPRS website or in our app.
This is a European Parliamentary Research Service podcast.
Thanks for listening.